The virus is easily transmitted. We've seen perfectly healthy people become very ill and in some cases die. With the weekend on us, don't let your guard down. Take the warning seriously. And if you own a business providing essential goods and services, we encourage you to stay open and practice social distances. If your business has been negatively impacted, please know that you can apply for a small business loan at the Lift Fund. Approximately 540 loan applications and more than 100 grant applications have already been submitted. Grants and loans will start going out next week. The need is great, so do your part, and we will all get through this faster.
We will be back again, same time, same place tomorrow with the latest information. So we're relying on you to understand the seriousness of the pandemic and the lives that are at stake. We've seen it other places in the country. So I can't say this in any more certain terms than this. Stay home, stay safe, stay healthy, and save lives. At this point, we're going to now take questions from the reporters who have joined us today.
Chevy, we'll get one question, and we'll start with Scott.
Yes, Mayor and Judge. I was wondering about the parks, the policy decision to keep the parks open, because obviously you want to allow people to have an opportunity to get some recreation, but at the same time, they can become magnets for gatherings. So I'm wondering where we are on the park situation and, you know, possibly any prohibitions to keep people off of the playground.
Scott, thanks for the question. The question was, there have been gatherings that seem to defy the guidelines of social distancing that have been happening in some of our parks because of playground equipment and ball courts, things like that. So the judge and I have discussed with our staffs, these are problem areas, and so we have made a decision to go ahead and close playground equipment and ball courts in the parks tonight effective.
We're going to be following that same policy, but we're also looking at the Easter weekend. That's when generally a lot of people come out early and crowds cluster. And so it may be possible that we will either close on Easter or really police it so that we don't have people coming together in close proximity.
Mayor, Judge, I have a question about testing. Yesterday it seemed that City Manager Eric Walsh had said that there was a pause on testing starting on this past Saturday as far as at Metro Health Lab, and correct me if I'm wrong in any of this. But one of the reasons we saw such a high number in cases yesterday was because some of those cases from that weekend started to get reported and accurately represented on the website. What is the status of testing right now? Is Metro Health Lab still doing testing? Is CDC doing testing? What's happening with that?
Well, I'll start, and maybe the judge can add to this. We just came out of a briefing with all of the hospital CEOs, STRAC, and all of the members of the testing community. And the challenge is all of them are doing testing at this point. Private providers, the Public Health Authority, they're running federal tests, they're running private tests. And just like every other part of Texas and across the country, the data coming back to us, it comes back at different intervals. And so there was a pause on testing. It was a state-ordered pause on the federal tests that happened over the weekend. We are now starting to get those tests rolling back into us. In the case of federal tests, that have to go to the federally approved labs, Quest and so forth, those are taking 3 to 5 days to come back to us, and that's the same all over the country. And so as we get more data coming in, the picture of the spread is getting much clearer. We'll be able to do much more data analytics that will help us to get a sense of where we are with the community spread and our ability to meet the capacity of the infections. But it's critically important right now that we obey these stay-at-home orders so we can continue to have the capacity to treat infections that we know are going to increase because of the testing.
You know, we're going to have to do a better job in the labs that the federal cases are sent to Quest and some of the others. 3 or 4 or 5 day turnaround is way too long. We started doing some work here. The Bexar County Hospital District, University Health System, is now testing. We've run 170 tests already, and we can turn that around in 24 hours. I know clinics are testing. I'm not sure what their turnaround is, but we really need to have a better turnaround than the ones that we're going through the federal program with and that are sent to Quest and other laboratories.
And I'll add one other thing, Joey. Both the judge and I, both the city and the county in our orders have required by law for the private labs to begin to report their results, not just positive infections, but also the total number of tests. That hasn't been happening, and so there were meetings, and actually the governor also placed that in his emergency order recently, so we're going to start seeing those testing results as well.
There's a lag in mapping in San Antonio in terms of testing and positive results compared to other parts of Texas. We don't know by zip code how many cases there are or what parts of town might have a higher number of cases compared to others. Why is there that lag, and when will that information be public, and isn't that important information for the public to have?
Sure. The question was, thank you, Dylan, for why is there a lag in mapping of the results, the testing results here in San Antonio as compared to other places in Texas? And I don't know the answer to that, frankly, but I do know that the Metro Health and the Public Health Authority is addressing it right now. I'd have to refer you to them, but we are pushing as hard as we can on federal, state, and our local folks here to give us as much transparency in the data. The truth of the matter is it's been difficult in some cases because of the lack of testing data, but as we get more tests back, we need to be seeing more of the analytics, including mapping.
Yeah, I'm not sure exactly how much that helps. If I've tested positive and I live in on Wurzbach Road, I don't know where I got it. I got it somewhere else. I sure didn't get it in my home, so it doesn't tell you where you picked up the COVID-19. It does tell you that you're in a neighborhood, and maybe your neighborhoods need to stay away from you. But you don't know where you picked it up. In all likelihood, you don't know.
Mayor. Antonio Guillen with Univision. Judge, in other cities, they have a plan for homeless, because homeless are seen as a very important vector of infection. If that sector of the population is not taken care of, you can take care of everybody else here, but they are in the streets. What is the plan? I haven't heard from any one of you that there is a plan to try to look into that specific sector of the population.
Yeah, well, thank you for the question, Tony. Do I need to repeat that one? The question is, where is and why does San Antonio not have a plan for the homeless population as it relates to the spread of this virus? And I can tell you that we do. In fact, the HUD shelter-in-place guidelines, unfortunately, don't help us a whole lot with this regard. But what we're doing right now is that we have identified 2 alternate facilities, hotels, where we can begin to move members of our public who are experiencing homelessness, who do turn up and are symptomatic. We also have a facility that we can move folks into that are who have tested positive to be isolated from the general public. We also know that they're working within the shelters themselves, including Haven for Hope, to do better with social distancing. There's screening of everyone taking place, everyone in those facilities that is experiencing any kind of symptoms. So we're working through those right now. At 2 o'clock today, there was a meeting of our Human Services Department with some of the homelessness providers. I have not been updated on that, but that is something we're very cognizant of, the prevalence or the difficulty of containing spread if it were to happen within the homeless community.
One other thing that I think is positively affecting that is the fact that people are not being evicted today. It's my understanding there's less people showing up that may have been evicted from their home and have no place to go. So by stopping people from being evicted, stopping foreclosures, as keeping a lot of people in their own living environment instead of maybe going out on the street or having to go to a social agency.
We've spoken to different families who have lost their loved ones due to coronavirus. Is there a plan of helping them economically to pay for their funeral expenses?
Well, that's a great question. Do we need is there a plan for relief of funeral services for those who have passed from the coronavirus? I have not been asked that question before. I don't know if there is one because we don't know the identities. I don't know the identities, but we will certainly look into that.
I don't either. We've had 5 people pass away because of the virus. We may see more in the future. I haven't even thought about that issue of a funeral.
That's the end of the live stream. Thank y'all for coming.
Thank you, guys.
And we'll be back here again tomorrow same time. So thanks, y'all.
Yeah, I think we have one question.